Dr. Ho, I'm general pediatrician, and I am knowing Patrick for the last 9 years. After I seen him first time in the nursery when he was born, and I have privilege to take care of him for the last 9 years now. Before I came here, I did have permission from the parent to talk about him, and he enjoying one Disney work now, and he's famous now down in Florida. So when I first met Patrick in the nursery, he was a tiny, small baby, and looked like a preemie with some deformities of his lower extremities and his upper extremities, some bowing bones, which questioning of some form of bone disease. And we were able to obtain a bone survey, and that's when we find out that he has several fractures, old one and the new one. So apparently he already had some fracture prenatal before he was born, and as well as active fracture when he was born. So, from that point, we have involved, have Patrick and the whole family involved to referring to different specialists, as well as Dr. Kathy Stevens was involved to confirm the diagnosis of what we thought was the osteogenesis imperfecta. And we have involved, seen by pediatric orthopedic as well, and it was Dr. Brown at that time who was seeing him for that disease. For the first month, I have seen Patrick quite often because he has had several fractures with or without cause. He can have fracture by lifting up or by turning around. So he had quite a bit of fracture by the time he's 1 month old. He has required several casting for his fractures. And I believe when he's 4 months old, we sent him, or Dr. Kathy Stevens sent him to Shriner Hospital for some infusion, which Dr. Moses can get more detail of those treatment for him. And he's been doing between my office, Shriner, and the specialist at the Children's Hospital, Erlanger. So he has, basically, he's been at the office in the ER for several fracture casting and some surgery as well to treat his fractures. And I can let that to Dr. Moses give more detail of the type of fracture the patient can have. He's been followed at Shriner for a period of time, I believe at least 4 or 5 years with infusion treatment. He also received physical therapy and occupational therapy for the last 9 years. The parents have been, I have been given to the parents the osteogenesis imperfecta foundation to be in contact with. And I do have a couple of my patients do have that type of disease, and I did give the parents their phone number so they can learn how to deal with that new condition that they have to familiar with to take care of Patrick. And they have been doing a very good job to protect him from any injury or any fractures. And I heard the other day that he has had 50 or at least 52 fractures with, I think I lost count because he has so many that sometimes that he comes to the office, sometimes he not, sometimes he go directly to ER to have those fractures taken care of. So I may see probably half of what the fracture that he has had. So, And the parent has been doing a good job taking care of the fracture. Sometimes they mention to me that they know how to do with post fracture. They don't even go to ER or go to the office. They just use the old brace or splint that they had before and just put it on, and hopefully it will heal by itself. So they have been learning on the way, on the long, how to take care of all of those fractures. And they have been doing a good job by doing that. Besides that, he has extensive, as I say, physical therapy, occupational therapy, and we just hook him up with swim therapy too. So anything with promote, the bone mass, the mobility, that would be great for his disease. So we try to build his muscle, to build his bone as much as we can in a safe environment. And here we are today because of the extreme makeover home edition. They did contact me a month ago, asking me what I feel about Patrick with the show, and I told them that he's a great kid, and the parents have been doing an excellent job keeping him healthy regardless of all the fracture that he has. And I told them it would be great if they can rebuild his house, make everything safe, cushioning, everything that he loves, the doorknob, the bed, the rail, everything is safe for him. It would be a great help to the parents. And the next thing I know was a couple of weeks ago, they come up to me and asked me how they can send the family to one of these temples safely. So that when I knew that he'd been selected to be on that extreme makeover home edition, and now they enjoy the one this neighborhood. So, but as I said earlier, the parents have been doing a good job, and especially the dad. If you see him, he constantly holding Patrick. Even now, he's 9 years old. You can constantly see him hold him all the time. I think he used to do that all the time, but he's just afraid that if he let Patrick down the floor, he may ring around and broken his bones. So he's constantly doing that. And the last time I saw him, like a week ago, he was 9 years old, and he weighed around 36 pounds. So he like holding a 3 to 4 years old child, and he'd been doing that for the last 9 years. So they have been doing a very good job taking care of Patrick, so to prevent him from any injury, volunteer and not volunteer. So, any question?
Is it typical that someone with his type of brittle bone disease would be that small, would have this level of breaks? And also, could you touch on which type of brittle bone disease he has? I've read there are 4 different types.
Well, there's more than 4, but Dr. Getty Stephen will go more in detail. But yes, patients with osteogenesis imperfecta, they have a short status, and they're not growing well. Yes.
And maybe if you have other questions, Dr. Moses and Dr. Stevens might be answering other information.
What type of preparations did you have to make for the Disney trip? Or did you tell them to make for the Disney?
Yes, I told them that anything like not bumpy ride, definitely not roller coasters, definitely no. But he can watch the parades and go any slow motion rides. It would be safe for him.
Does he not feel the same level of pain when he breaks a bone as we would,
really.
or?
No, I think he's has so many that he's learned how to deal with those fractures. And I have been seeing him with different devices to help him moving around. I have seen him in the stroller. I have seen him on the wheelchair, in the walker, on brace. And I even see him one time in the scooter. Of course, not standing on the scooter, but laying on the scooter.